I was asking myself, what is the next step? What are you gonna do next? I was scrolling on my social media and I found Avant Healthcare, and I learned that maybe coming to the United States was a good idea, a new challenge. I'm a person who is motivated to challenges. That might be my call. Yeah. I'm gonna give it a try.
We're Avant. We help nurses move to the U.S. and secure an employment-based visa.
We're Avant. We're going to help prepare you for the NCLEX, and we're going to coordinate your travel to the testing center if needed.
We're Avant. We're going to help nurses prepare for their English exams for visa screen purposes, so there's one less thing you have to worry about.
We're Avant. We're going to do all the complicated immigration and licensure paperwork for nurses.
We're Avant. We're going to provide clinical and cultural transition support, so the only thing you have to worry about is enjoying your new home.
How to be a successful nurse in the Avant program. Part 4, be honest. Seriously, being honest helps you succeed. Whether it's your experience, your education, or your test scores, being honest helps us match you with the right opportunities. Our recruiters can tell if you're giving us wrong information or if you're leaving something out. This only slows things down and can even disqualify you. Remember, we're here to support you. Honesty builds trust, and that's what makes the journey work.
For me, if you ask me, I would each time choose Avant over any other agency. Why am I saying that? Because Avant has really demonstrated that they are able to meet the dreams of many nurses across the world, especially my country where I come from. In fact, choosing Avant, I haven't regretted.
Do you know that your hospital where you currently work affects your eligibility for placement on Avant's program? To qualify for placement with our U.S. clients, you need to be working currently as an RN in a clinical setting that is preparing you for safe and successful nursing in the U.S. as well. So generally, we look to see that the nurses we are going to hire are working in a hospital that has at least 80 beds and offers a high standard of care. Even some hospitals that have 80 or more beds may not be the right match due to the standard of care or resources or even the kinds of cases or skills you see and perform there. So we do a very comprehensive look into your experience to make sure that if we have you join our program, you are going to be successful throughout the process and ultimately successful long-term in your U.S. nursing career. So yes, unfortunately, there are going to be some hospitals that may not be the right match, even if you are an exceptional nurse. Not sure if your hospital qualifies? Please email recruitment@avanthealthcare.com so we can help.
Kenyans, USRN tuanguke nayo, Avant ndio yenyewe. It's the in thing. So let's do this.
What's the most important thing that an international healthcare professional needs to know at this stage?
So at the interview stage, we're going to be talking to you about your work experience, about your, if you've done the NCLEX, if you've done the IELTS. We're trying to get an understanding of what your experience looks like and what your goals are professionally, personally. What's important to you? Who are you planning to bring with you to the U.S.? Have you thought about the transition for your family? We want to talk to you about such important things to make sure that we're a good fit for what you're looking for, and also that you're a good fit for us and the clients that we have here in the U.S. And so one of the pieces of advice I always say, something that's so important, is to be honest and to be yourself. Be authentic, yes, display professionalism, all those things are important, but everyone is so individual and has such special dreams and has a different...
What advice would you give to someone who wants to be a USRN?
My advice would be to just go for it. In all honesty, go for it. I know it's a leap of faith. I know sometimes it can be scary, but sometimes you just have to trust your instinct. And actually, being in the position I am in now with Avant, I can honestly say that I don't regret it.
I have to have my IELTS and NCLEX in order to apply with Avant. Myth, you can absolutely apply with Avant Healthcare Professionals even if you haven't already passed NCLEX or IELTS. We're happy to consider your application. I can't bring my family with me to the USA if I move there to work as a registered nurse. Myth, you absolutely can include your family on the green card petition that is filed by Avant as long as it is a legally married spouse and or children under the age of 21 before arriving to the US.
I had seen my colleagues, most of them, they had come through Avant, and I think what people are built to. Like you would go where so many people are going. Like it's so attracting, because I was like, okay, if so many people that I know have gone through Avant, then I think this is something, or these are people that I can really trust with my process.
The people here are very welcoming. They want you to experience America as is, visit new places, interact, feel like you are out of that shell, because the world is your oyster,
Roll in my hands, okay? 3, 2, 1. Hello, everybody, and welcome to today's live hiring event. We are so excited to see all of you fantastic, amazing nurses in the chat right now. How are you doing, Anna?
I'm doing great, Alistair. How are you?
I'm doing fantastic. So, yes, I'm Alistair. This is Anna. We are from Avant Healthcare Professionals, and we have got a very, very fantastic day lined up for you. So, what is a live hiring event? What makes today special?
Well, live hiring events are events that we put on here at Avant where you can apply, get your application expeditiously reviewed, and potentially even get an interview today. So you can get on the phone with a recruiter to get this process started.
But to do that, you've got to apply. Make sure you get that application in. If you're looking for a sign, this is it. If you haven't done so already, make sure you send that application in. Our recruitment team is standing by. They are on the phone right now as we speak. They are waiting for your call. Do not delay. Make sure you get that application in right now.
Right now.
Absolutely, at this very second. So this may be actually a few people's first time hearing about Avant, or their first time coming across us. So let's talk a little bit about who we are.
Yeah, so if this is your first time hearing about us, welcome. We're so glad to have you here. Avant Healthcare Professionals is one of the leading healthcare staffing agencies. We specialize in helping internationally educated healthcare professionals travel and work here in the United States. So we've been around for quite a while, over 20 years. We were founded back in 2003 by a registered nurse, and even today, we are still led and managed by nurses across many of our teams. We're headquartered in Orlando, Florida, so sunny Florida. And we have over 200 dedicated corporate employees that offer that personalized support for you each and every step of the way. So there's a lot of different steps to this process, but you don't have to do it alone.
That's absolutely right. Support is the name of the game. It's really what we're most proud of. We love supporting you from the very day that you apply, right up until even at the end of your contract. We are there to support you. So that's a little bit about us. We want to hear about you. So in the comments, why don't you tell us, where are you coming from today? Let's see. I want to see all the countries that we've got in the chat. I think I saw Ethiopia. I saw before. Who else have we got? Where else have we got?
We've got some Ghana. Hey, welcome from Ghana.
Good to see you guys. Nigeria's in the house. Who else have we got?
Oh, Kenya, of course.
Kenya,
welcome.
Always. My first question to Kenya, always. Niaje, poa sana. Hey, there we go. That's why Haley's good, right? Huh? There we go. Fantastic. Who else we got?
We got Malawi, too.
Hey, fantastic.
Nigeria.
Rwanda.
Awesome.
Unbelievable.
Really covering many different countries, all the different corners of Africa.
It's like this, like the United Nations in here. This is amazing. All right. Fantastic. Well, so glad to hear from you guys. So, we know that when you're picking who you want to partner with on your journey to the US, the top priority is picking a name that you can trust.
Yes.
And that is a big, big priority. I'm absolutely certain.
For sure. So, I mean, there's a lot of different reasons why we can say here at Avant, we pride ourselves in being extremely ethical and trustworthy. And just to name a few, we are an Alliance certified ethical recruiter. This is something that True Merit, formerly known as CGFNS, does and certifies different agencies. So they have, agreed that we are trustworthy and ethical. We are also healthcare staffing. We have a healthcare staffing certification through the Joint Commission as well.
And we're also a founding member of the American Association of International Healthcare Recruitment. So you can be assured that when you apply with Avant, you are picking a trusted name that has been in this industry for a long time and will be for many years to come.
Yes, definitely.
Absolutely. So, Anna, why don't you give us some numbers?
Yeah. So, I mean, in those 20 plus years that we've been in business, we've actually helped nurses, and other healthcare professionals from over 70 different countries come and migrate to and work here in the United States. We have a very diverse client base, so healthcare facilities that span across the entire country. Right now, over 700 different healthcare clients that we're working with. So
absolutely
a lot
amazing.
of different options for placement.
Absolutely. But you're not going to get that placement if you don't apply. So if you've not done so already, make that application right now. You can find the link in the comments. It's pinned at the top of the comments. Make sure that you get that application in. You do not want to delay. So once I've made my application, what's next? How does the process work?
Oh, you just come right to the U.S. No,
is that easy? No, I'm sure
we wish. No, but there's quite a few steps from step one to when you can actually come to the U.S. So we've created this process roadmap here, and we're going to go through a couple of the different steps. So as you can imagine, with most employment opportunities, the very first step is a hiring process. So as we've already said many times today, and we'll continue to say, if you haven't already, make sure you submit your application. And I'm not going to talk about the hiring process too much right now, because we do have a really special segment towards the end where we're going to give you some really great interview tips and tell you more about our hiring process. But ultimately, you submit your application, our team reviews your resume, you go through a series of interviews, and hopefully are offered onto the program. And if you do accept the offer, we'll collect the documents needed for each and every step of the way that is yet to come. And for those of you who haven't taken the NCLEX yet, by the time you apply, that's really going to be one of your very first steps.
Absolutely. So, and stick around, because later on today, we are going to be talking all things NCLEX with the fantastic Megan from our NCLEX team. So stick around. And, NCLEX is one thing. I know a lot of people have been talking about that. There's another word on people's lips, part of the immigration process that a lot of people have been talking about. The word is retrogression.
Oh, sure. Yeah.
Okay. So first things first, what does that word mean? What is retrogression? What is it all about?
So retrogression, we're going to talk about immigration here. So just really quick, immigration is something that we do assist with. We do provide an employer-sponsored visa. Now, when we file this visa, we're filing what's called an EB-3 visa.
Okay.
It's employment-based. Category 3. We'll talk more about that in a minute. But yeah, right now there is a retrogression, which is essentially a delay in issuing those visas. And this delay, it does come from U.S. immigration, not from Avant.
Right. That's absolutely right. And so if I'm in the immigration process, I've made my application, I'm waiting for my turn. How do I know where my place in line is?
So you know where your place in line is by your priority date.
Okay.
So a priority date that's kind of your place in line. You'll have what's called a priority date. Now, how you know whether that means you're going to get your visa now or not, we can look at what's called the visa bulletin. So we'll pull that up on the screen. I have a copy here in my hands too. So you can find this on the USCIS website. And if you scroll down to the area that talks about the employment-based visas, you'll want to look for this chart A, final action dates. Now, how to read this. So like I said, we file an EB-3. So you want to look at the third category. That is where registered nurses fall under. Now, for those of you tuning into this event, most likely you're tuning in from Africa, right? This is a live hiring event for African nurses. So if you were born in an African country, you would be looking at that very first column there called all chargeability area, except those listed. Essentially what that means is you want to look at this column and not the others, because unless you were born in China, India, Mexico, or Philippines, your priority date, the date that you want to look at is in this column here. So what you see in the third category under all chargeability, the current date is listed as April 1st, 2023. So this bulletin is released each and every month. So this is the bulletin that came out now for September 2025. So what this means is you would have had to have a priority date of before April 1st, 2023 to be at the front of the line and ready to receive your visa.
Right, currently in process. And remember, guys, this does change. This date does change. It can move forward, it can move back, it's going to move all around. So the most important thing for you is to get in that line right away, to get in that line as early as possible.
Yeah.
The only way you can do that is by applying. And so get out there, get your application in, And, our recruitment team, they are waiting. They are on the phone all day today, and they just want to hear from you. So if you've not done so already, get that application in right now. We can't wait to see you.
Yeah. And we know that some of these things can feel complicated, NCLEX, immigration. How am I supposed to do it? Again, by you joining the Avant program, you get the support for each of those steps. So you're not going through the NCLEX review alone. You're not going through the immigration process alone. We are here to help. But with immigration, so it can obviously take some time, especially since there is retrogression. So while you are waiting to receive your visa, there's still things to get done through this process. So the next step after we file your immigration petition, one of the things you're going to have to do is pass an English proficiency exam. So I actually saw in the comments earlier, somebody was asking, do you accept OET? And the answer to that is yes. There's quite a few different exams that we can accept for an English proficiency test. Now you can find a list of which exams are accepted on the True Merit website. But just to list a few, we can accept the academic IELTS. We can accept TOEFL IBT, OET, PTE. So any of these exams that you'd like to take, we'll discuss it with you, which exams are available for you and when you need to take that exam by. But English proficiency is something that most internationally educated nurses will need to take in order to come to the US.
Does my Duolingo count?
Ooh, Duolingo does not count, unfortunately.
No, maybe next time. Maybe.
We love that little owl. So another thing that you'll be working on while you're waiting to arrive in the US is our pre-arrival clinical education program. We call this PACE here at Avant. We love our acronyms. And so during the pre-arrival clinical education, you'll be assigned a series of modules to complete. So this will be, of course, after you've already passed the NCLEX. So you've learned a lot about, nursing in the US and what that looks like. But this program is to kind of help bridge any additional gaps in training in terms of what you'll be actually doing as a nurse here in the US. So there will be modules assigned to the specialty that you'll be working in. And you just get to learn a little bit more about different skills and different things that you'll be doing as a nurse in the US just to kind of get you even more prepared.
Fantastic. And then once you receive that fantastic envelope with your green card and everything, or with your passport, visa, I should say, then you get to come to the USA.
Oh, but before that, one thing we have to do is figure out where you're going to be working.
Oh, of course.
Yeah.
Of course.
So before you arrive in the US, this process actually does get started. So we'll say roughly about 6 months or so before you come to the US, we'll start looking at what options we have available when it comes to where, we said earlier, we have about 700 plus clients across the US. So which one of those clients will you be working at? We'll look at things like, what kind of experience do you have? What skills do you have? And find that good placement. So this is where you can tell us, oh, I would really love to work in Texas. We'll say, okay, let's check to see if we have any openings in Texas. And if we do, you'll interview with the client. And if they feel like you're a good fit and extend to you that position, then that is where you'll work. But ultimately, you need to be flexible when it comes to placement, and your recruiters will definitely talk with you more about that. But so you'll figure out where exactly you'll be working a bit before you arrive in the US. But yes, then
it's arrival time. And then you can join us on the Cultural and Clinical Transitions Program here in Orlando, Florida. It is a fantastic opportunity for you to brush up on your clinical skills, but also your cultural knowledge of the USA. We want to make sure that when you come over here to the USA, that you are ready to go, that you are not left alone, that you have all the support that you need so that you can succeed while you're on assignment. So after finishing up in Orlando, off you go onto your assignment location, wherever that may be across the USA. And the support doesn't stop there. Throughout your time on assignment, you will still get support from Avant. We'll check in. We'll make sure that you're adapting to your new facility well. And altogether, we just want to make sure that you have just the best possible time that you can while you're on assignment. So fantastic. That's a trip through the process.
Yeah, very quick.
So yes, so you can take advantage of all of that fantastic support by applying today. Make it happen. We said it before. I'll say it again. You're going to hear this a million times before we finish today. We want to make sure that you get your application in right now. Our recruiters, they are waiting. All they want to do today is have calls and hear from you. So if you've not done so already, make that application happen. Get it in there because we're just waiting for you. It's all on you. So get it in there.
I mean, it's a live hiring event after all.
That's
Step
it.
number 1, apply.
Apply if you haven't done so already. All right, fantastic. So we've talked a little bit about the how.
Mm-hmm.
Let's talk about the why. So first of all, I want to hear from the chat. Why don't you put in there, why do you want to become a USRN? Why is it that you want to move to the USA to continue your nursing practice?
So as we wait for those comments to come in, I'll tell you a little bit about the reasons we hear from nurses. Number one, there's no cost for our services. I did see a couple questions in the chat around this already. So yeah, as long as you complete the 5,200 hour contract here in the US, you do not have to pay Avant back for any of the support that's received. So we've already mentioned we support with NCLEX review. We support with the NCLEX testing as well, as in costs of travel, accommodation, and taking that NCLEX exam. We cover the cost for the immigration as well and your flights to the US. So all of those things are included in our program and don't have to be paid back as long as you complete the hours of the contract. Again, we do provide an employer-sponsored visa. So this results in a green card, which is permanent residency here in the US. So if you're somebody who's been looking at potentially becoming a US citizen, this is the very first step towards that. So that's really great. Like Alistair mentioned, we have our Avant Transitions program. So we're going to help you both adapt culturally and clinically to the work and life here in the United States. And while you're working on contract here, this is a long-term contract with one client or one hospital, which means we're not, a travel agency. You're not going to be moving around every couple of weeks. This is really an opportunity where you can plant some roots, really build a new home in a new place, make new friends, build a community. And while you're on assignment, you do receive that continuous support, as we've mentioned, throughout the entirety of the contract. And once you reach the end of the contract, if you've enjoyed your work, you want to continue working there, we will actually provide you with support to become a direct staff of the facility. So you'll finish your contract with Avant and start working directly with that hospital instead.
Absolutely. So there's just a million reasons why you'd want to pick Avant. I saw in the chat, I saw people saying, we're looking to help my family. I'm looking to grow professionally. That we've got Mame saying we're very legit and everything, and we take very big pride in that.
I saw best agency there.
Best agency.
Love that.
We love the love in the chat. Keep it coming. Keep it coming. But yes, there is just so many reasons to pick Avant. And we're just waiting for you. So we are so excited to continue with the rest of our programming today. So when we come back, we're going to be talking all things NCLEX, and we can't wait to talk about that. But before then, why don't we hear from our very good friend Faith, who is out in Kenya. Take it away, Faith.
Hi, everyone. My name is Faith Atieno, joining you all the way from Nairobi, Kenya. I am a candidate support coordinator working with Avant healthcare professionals, and my role is to work alongside nurses from the time they apply. So don't be surprised if you get a call from me. If our Avant team has questions regarding your CV and work experience, I will be reaching out to you or even reminding you to schedule your interview. Or if you have questions regarding your contract or next stages, feel free to reach out to me. Nurses in Kenya, you are more than welcome to schedule an in-person consultation with me. I am based at the Strata Staff Office in Nairobi, Westlands, Muthidi Road. One of the best parts of my role is getting to see each nurse proceed through every stage of the journey. And today I am so excited because I get to share this moment with Evans Muriuki, one of our incredible nurses I first met during last year's May 2024 live hiring event. Hi, Evans.
Hi, Faye.
How are you today?
I'm good. Thanks for having me here today.
Of course. So Evans is one of our incredible nurses who got to interview during our live hiring event, and he is at the advanced stages of the process. Evans, what stage are you in right now?
As you mentioned, Faye, I'm in advanced stages of my immigration process as I transit to the US.
Awesome. So you're in the immigration stage.
Sure.
So Evans, let's start from the beginning. How did you first hear about Avant and what made you apply?
Well, I first of all heard about Avant back in school. Through my colleague, they used to tell us there's this organization called Avant that used to help nurses transit, register nurses transit from Kenya and achieve the American dream in the US, that is to practice there. Luckily at my workplace, I came to learn a nurse who is my friend. She's Betty. She's living her life in the US at the moment.
Oh, nice.
Through Avant. She's practicing her skills there. She guided me on what basics I require and how I can apply with Avant. I applied with Avant. Fortunately, there was a live hiring event in May, which I got to to be scheduled for the interview that particular day. So I was able to go through the interviews, the 2 interviews, through your guidance, Faith, and I managed to get the contract that particular day, which I ran through very nicely, keenly, and I signed the contract and sent it to Avant. I'm so much indebted to you. Thank you so much, Faith.
How has the process been for you? How has the experience been for you after the live hiring event?
They took hold of my hand throughout the process. From the hiring event, I got the next step whereby Avant will subject you to an instructor on each and every step. Jenna Dixon was my instructor. She was able to carry me through the document verification, all the emails that I received. In case I got stuck, just read through the emails very keenly, slowly, just get through them. And just in case you get stuck, maybe through the document verification, maybe the fingerprint, Faith always got our hand. You're doing a great job, and we appreciate you for that.
Thank you so much. Of course. I understand that you did your NCLEX and you passed, which is great. Could you take us through how it was for you before the NCLEX, during, and how did you feel after the NCLEX?
So it's not an easy process, but with Avant, let's be honest, the NCLEX process is doable. The NCLEX exam itself, it's doable because Avant will make it to be very simple. The beauty of Avant, they will work with your schedule. They worked with my schedule very nicely. I was able to manage work, I was able to manage my life, and I was again able to manage the course content of the module so that I can be able to achieve the American dream by doing the NCLEX. What I can tell all of us and all Avant students, be checking your emails frequently. That will help me. I used to check my emails more oftenly than I used to be previously, and I was able to read the emails and achieve the required timelines. Avant will give you timelines. It's your responsibility to be able to achieve the guideline, the timelines of the responsibilities required of you.
So looking back on everything, Evans, what has been your best thing about Avant? What would you say is unique about Avant?
One thing I will really appreciate about Avant is clear communication. Clear and concise communication. I was receiving emails frequently. It was my requirement, my responsibility, and my duty to check my emails every other time. So good communication. With good communication from Avant, you're required to just submit your assignment, do your responsibilities as humbly as they require.
We are hoping and looking forward to seeing you go through this process till the end. But thank you so much for hanging out with us today. Over to you in Florida. Bye.
Bye-bye.
All right. Thank you so much, Faith. That was awesome. And thank you so much, Evans, for sharing your experience. I hope you all were able to gain a lot of really good information from that. As you can tell, Alistair has left the building, and I am joined now by Megan, who's a member of our NCLEX team. Hi, Megan.
Hi. Thank you so much for having me today.
Thank you so much for being here. We're so excited to learn more about the NCLEX. So if you could just introduce yourself a little bit and tell us, first of all, like, what is the NCLEX?
Sure, absolutely. Well, happy to be here today. And like Alistair said, apply. But my name is Megan, and I'm with the NCLEX team. And what the NCLEX is. So NCLEX stands for National Council Licensure Examination. And it is this exam that any nurse who wants to work here in the United States must take and pass in order to be eligible to practice nursing.
Yeah, so kind of the first step, right?
Yes. Yep.
So what does the typical NCLEX journey look like here at Avant for an internationally educated nurse?
Sure, absolutely. So our goal is to get a nurse in and through our program and to pass NCLEX in about 6 to 7 months. That's our time frame. Though if you would like to get through sooner and you have lofty goals for yourself, you can, of course, work quicker through our program, as our program is designed to be asynchronous for our learners. And so it really is designed for the busy working nurses, because we know all of our nurses are still required to work full time. And so our program is 3 phases. Each phase consists of different things, requirements that they have to meet, and then they'll be able to be eligible to take NCLEX once they pass through all 3 phases.
Cool. So like 6 to 7 months. And I've heard that it still requires quite a bit of studying. That's like 10 to 12 hours of studying a week.
It does. Yeah. Yes. Though we have created the program for those who are working full time, it does still take dedication and commitment on the part of the nurse.
So what would you say are some of the biggest challenges that a nurse might face when preparing for the NCLEX, and how do you and your team help them overcome those kind of challenges?
Sure. So the NCLEX exam is a critical thinking exam. So unlike most exams that one might take through school that are knowledge-based, NCLEX focuses on critical thinking, meaning that nurses have to be able to develop those skills to determine, well, what are you going to do first? How am I going to keep my patients safe? And oftentimes, the questions are all going to be right, but it's which one are you going to do first?
That's tricky.
How are you going to keep that patient safe? And so we teach, we guide, we show you how to be able to answer these questions correctly by all of our different testing strategies and our classes and courses that we provide along the way.
Great. Yeah. And so we know that NCLEX can be intimidating. I know that's something that I've heard from nurses who are applying. They're nervous about taking the NCLEX. So how does our program support nurses emotionally on top of, the ability to learn and how to take the test?
Absolutely. So there are 5 of us instructors in the Avant NCLEX program, and we love what we do. We're all registered nurses with the state of Florida. We all hold active licenses. And so you are assigned to one of us, even though we all teach group coaching sessions, testing strategy sessions, you are assigned to one of us, and we can have one-on-one coaching with you, small group coaching sessions with you, email communications back and forth. And so that line of communication is open between the tester and the NCLEX instructor. And so we can provide support in any way, shape, or form. And if you just want to call to chat about something going on in life, we are more than happy to talk about those things. For pregnancies and even those not so great things like divorces, we talk through those things, and we're here to support the nurse on more than just an academic level, but on a personal level as well.
Yeah, because I'm sure that has a lot of impact on the day of testing, or just how to get your studies done when you've got all this personal stuff going on.
Yes, absolutely.
But that's awesome. So all of you are registered nurses, which means they've taken the NCLEX too.
Yes.
Know exactly what you're going through. So, but Megan, you've been with Avant for a while now. Do you have an inspirational success story or something that you could share?
Sure. I don't know that I can pin down just one because we've had so many successful stories come through, but I would say that those who are successful on NCLEX are those that are dedicated, those that are going to put in the hard work, those that keep that line of communication open. Because remember, we are a virtual program. And so it does take a lot of communication back and forth between the instructor and the nurse, sharing in those things. And if you have instances in which you can't get an assignment done on time, to reach out and to communicate and keep that line open between us.
For sure. Yeah. If you've watched any of our presentations in the past, that phrase right there, communicate, that is said quite a few times. But so for nurses that are watching today and they're thinking, can I really do this? That sounds really tough. How can you encourage them?
Absolutely. Yes, you can. First, you have to apply. But yes, you can absolutely pass the NCLEX exam. I am so proud to say that our program has one of the highest pass rates of all international programs in the United States for international trained nurses. And I'm happy to say that. And so you can do this. We teach you time management skills even in order to be able to get through this program. And we're here to support you every step of the way. And so we want you to apply and join our team here at Avant.
Yeah. And if you join, maybe Megan will be your instructor one day.
Yay.
So Megan has actually prepared some really exciting NCLEX questions for you all. So get a little taste of what this review might actually look like. You want to take it away?
Yes, absolutely. All right. So first question that's on the screen for you today is the home health hospice nurse visits a client who is newly prescribed extended release oxycodone 40 milligrams orally, scheduled every 12 hours to treat severe chronic terminal cancer pain. Which information is most important to reinforce to the client's caregiver? Is it going to be A, administer the medication around the clock even if the client denies having pain? B, avoid administering with immediate release opioids to prevent respiratory depression? C, change the dosage and frequency to 20 milligrams every 6 hours if breakthrough pain occurs? Or D, request a tapered dose from the healthcare provider if pain decreases to prevent tolerance.
So think about what you think is the right answer, and then put that in the chat. We want to see kind of where your heads are at. And I'm sure Megan will give some insight as to what the right answer is.
And this is one of those prioritization questions, right? Which information is the most important to reinforce to the client's caregiver? So I see lots of answers coming in through the chat box here. I see some B's, I see some A's, I see some C's. So I kind of see all over the place. But let's talk about what you guys think is the right answer and what really is the right answer. So for those of you who chose A, you would be correct. So the correct answer, administer the medication around the clock, even if the client denies having pain. The rationale for that, and that's one of the important things that we go through when we do our question clinics and our testing strategies, is providing you with the rationale. Why would that one be correct? Not just it's correct because we say it's correct, but why is it correct? And just real quick here, long-acting controlled release opioid drugs for chronic pain require regularly scheduled dosing to maintain a therapeutic drug level. Immediate release opioids may be required for breakthrough pain. And long-term opioid use leads to tolerance and physical dependence, so higher doses are eventually required for therapeutic effect.
So if you got that question wrong, that's okay. That's why we have this NCLEX review, to help teach you those kind of strategies. So we got one more practice question. Let's see.
All right, let's see if anyone can go 2 for 2. All right, here we go. Question number 2. The nurse is caring for a 10-year-old diagnosed with osteomyelitis on IV antibiotic therapy. What is the best activity the nurse can suggest to promote age-specific growth and development during hospitalization? Is it going to be A, fantasy play with video games? B, invite friends to come visit? C, provide missed schoolwork? Or D, watch favorite movies? What do we think? We've got some answers. Wow, already coming through the chat box. That was fast. So we've got age-specific growth and development during hospitalization for a 10-year-old.
I'm seeing a lot of B's in the comments.
I am seeing a lot of B's. So the correct answer is actually C, provide missed schoolwork. Again, want to talk about the rationale why. So I don't know if you guys remember way back from nursing school, maybe for some of you it's been quite some time since you were in nursing school, but according to Eric Erickson, I hope you remember that name, it's an important name, school-age children deal with conflict of industry versus inferiority. So attaining a sense of industry, which is also known as competence, is the most significant developmental goal for children ages 6 through 12. That is why answer option C is the correct one.
Wow, I've already learned so much. Well, thank you so much, Megan. So that's just a little bit of a taste of what you might get in the NCLEX review. If you're interested in getting that kind of support, studying for the NCLEX, being able to pass that NCLEX on your first try, make sure that you submit your application if you have not already today. Please apply now so that you can be a part of this live hiring event and maybe even get interviewed today. We're so excited that you're with us. And thank you so much, Megan.
Thank you so much for having me.
It was great having you. So we'll be right back after this little commercial break with Alistair again. And we're going to bring you some really important interview tips for those of you who do have your scheduled interviews coming up. So we'll be right back.
So my name is Agatha and I'm coming from Kenya. The journey to becoming a USRN started, back in time when I was in college. And our lecturer then could keep saying that once you are a nurse, you have endless opportunities. And at that point, this clicked my mind and I knew I had to pursue this dream to become a USRN at some point of my career. I chose Avant because there is a lot of visibility for Avant on the social media platforms, on YouTube, and you get to, know what Avant is and what are their core values and what they stand for and what a journey with them would actually take. So for me, it's been about their dedication and, being so intentional to guide their, nurses through the process. It's so lovely because for everything that they do for you, they have a department for it. If you're studying for NCLEX, you have the NCLEX review. If you're traveling, you have a traveling team. If you're licensing, you have somebody for that. So, that is so incredible. wow, the hardest part of my journey is that, when you start this journey, your life does not stop. So you keep moving. And at the point I was about to do my NCLEX exam, I was expecting my now last born. So I had to study, I had to, bear with this pregnancy journey and what it had to take. And eventually did my NCLEX exam with my baby at 7 weeks. So that was pretty tight, but importantly, I made it. It was so worth it, and I had massive support from my family. Big up to them. The people here are very welcoming. They want you to experience America as is, visit new places, interact, feel like you are out of that shell, because the world is your oyster, My favorite thing about Avant is the Avant transition program. I mean, they prepare you for everything. The culture itself, because when you get here, it's a huge culture shock. You need somebody to walk you through what is expected and what you should do and stuff like that. The second thing is that, they understand that our systems back home are not similar to what is in the US. So they are so intentional on taking you through the skills, their health information record systems, and a lot of things, and what is the expectation of a patient when you're there for them as a nurse. So that has been, incredibly amazing. If you're a nurse looking forward to take on the, US RN journey, go for it. Nothing should stop you. Just go for it. It's like a broken down process. It should not overwhelm you. Start small and keep your eye on the goal, and the goal is to transition through, because it's beautiful to be here.
Welcome back, everybody. Oh, what did I miss?
Quite a bit.
Quite a bit. All right. Okay. Well, fantastic. We're so glad to see so many of you in the comments. You guys have been so active all day. We are just having a blast. And the fun doesn't stop here. So we're going to continue on with our live hiring event today. And we're going to be continuing on all through the day because we are waiting for your application. Get it in right now. If you've not done so already, please. We are just waiting for you. That's all that we need is your application. Our recruiting team is standing by. They are on the phones. They are waiting for you. So if you've not done so already, get that application in.
Yep. We are ready to receive it.
We're ready. We're just waiting on you. So bring it on. Bring it on. All right. Fantastic. So I got inspired actually by Megan. I thought those were some fantastic questions. So I thought, why not ask some more trivia questions?
We love trivia.
These ones will be a little bit less technical, I think, but we should still have some fun. So let's have a look at some general USA trivia questions. All right. First question. Approximately how many languages are spoken in the USA? Is it A, 250, B, 340, C, 380, or D, over 450? Interesting question. How many languages do you speak, Anna?
Fluently 2.
Fluently 2. Fantastic. I speak 1 fluently and 3 quite well. So
good.
I'll take that. I'll take that.
All right. So we got at least, I think, 4 or 5 languages.
We've covered a few. All right. I'm seeing some people saying D. I'm seeing some C's, some B's in the chat. Jinye says D. Fantastic. Love seeing those answers come in. Adisu saying B. All right. It's multiple choice. I'm going to give you 5 more seconds. 5, 4, 3, 2, 1. The answer is over 450 languages. Isn't that incredible?
That's crazy.
Languages from all over the world.
But I mean, it makes sense.
Of course, we're a very diverse country. If you're in a city and you're moving around, you're likely going to hear people talking from all over the world. It's a great place to be.
Yeah, definitely. It's one of my favorite things to do is kind of guess the language.
Yes. Is that Gujarati? I can't remember. Yes, fantastic. So let's have our next question. All right. Ooh, here we go. In which month does the USA celebrate Thanksgiving? Is it A, July, B, November, C, March, or D, September?
Well, this is making me hungry. Because
favorite.
Thanksgiving, you eat a lot of food.
Absolutely. The turkey, the cranberry sauce,
Oh,
the mac and
sure.
cheese. Sorry, saying this to a pregnant lady is very cruel. Very cruel. However, get those answers in. Valerie is saying D. I like to see it. When else are we getting? Okay, Lily's
says
saying
B.
B. All right, July. Chica saying D. All right, get those answers in. I'm only going to give you 10 more seconds. 9, 8, 7, 6, 5, 4, 3, 2, 1. A half, a quarter. It's B, November. November is correct. It's the last Thursday of every November.
Right around the corner. I can't wait.
Oh, I've
Counting
been
down the
thinking
days.
about that mac and cheese for a long time. I can't wait to
so
have
good.
it. And before you know it, you might be having your first Thanksgiving in the USA as well. So keep your eyes peeled. All right, let's have another question, shall we? All right, which of these states is the largest by area in the USA? Is it California? Is it New York? Is it Texas? Or is it Florida? Our home state of Florida. Could it be? Could it be?
I think I know the answer to this one, but
yes.
honestly, this could be a tricky one.
I think people might be tripped up by this one. Let's have a look. Comfort saying B. Who else have we got? Let's have a look at some of these comments. Oh, Tizetta saying B. Queen Michelle saying California. Interesting stuff. America is just such a vast country.
It
isn't
really
it?
is.
It is so huge. I mean, even just here in Florida, we can drive from the very bottom to the very top, and it takes us about 12, 16 hours.
Like a whole day.
If you drive 16 hours from Manchester, where I was born, you end up in France.
Yeah.
You're in a whole different country. It's unbelievable. So let's have a look. 5 more seconds. 5, 4, 3, 2, 1. The answer is C, Texas.
Yeah, I saw a lot of B's though. New York. It's funny because New York is probably the smallest state
Of
on
those
that
of
list,
those listed, it
but
might
it's
be
tricky because
That's right.
New York City is so big.
That's right. However, Texas, they say everything's bigger in Texas.
Yes,
It is
sir.
enormous. It's an enormous state. So fantastic. Well done to everybody who got that one correct.
Good
Let's
job.
have another. Throw another one on the board for us. All right. Approximately how many people live in the USA? Is it 250 million, 340 million, 430 million, or 520 million? A lot of people living in the US.
Yeah. You think about all the different languages too. It's like, okay, is how many people are there? And
Yeah.
how many different languages are they speaking? Like,
Absolutely. Such a diverse country. It's one of my favorite things about the country that we live in.
that's why they
It's
call it the
just-
melting pot, right?
Absolutely. It's so nice to live in such a diverse
So
place.
a lot of C's coming in.
Yes,
Some
a lot of people having
Ds.
those guesses. Fantastic. All right. Pasca's saying D.
A.
All right. I'll give you 5 more seconds. 5, 4, 3, 2, 1. It's B, 340 million. Hey,
That's a tricky one.
Why do we make it 340 million and 1 when
Yes.
you come and join us after you've made your application? How about that? Let's make it a deal.
Love it.
All right. I think we got time for one more question. Let's have one more.
What do we got?
All right. On what day do Americans celebrate Independence Day? Is it A, June 4th, B, July 4th, C, March 4th, or D, August 4th?
I'm gonna take a wild guess and say it's on the 4th.
It is on the 4th. That is correct. You do not get any points for that, I'm afraid, Anna. So get those guesses in. If you're not certain, have a guess. You've got a 25% chance. All right, fantastic.
Give them a little
Love to see
hint. It's a great summer holiday.
Okay. Oh, you're
But
being very friendly right
That
now.
could be tricky. A lot of nurses that are in Africa right now are below the equator, so we have opposite summers, opposite winters.
Clever. Fantastic. Have that guess. If you're not certain, have a guess. All right, 5 more seconds. 5, 4, 3, 2, 1. It's the 4th of July.
Yes,
of
I see
course
Frank
it is.
even wrote it out. 4th of July. You are
Hey,
correct.
Very good. Very good job, Frank. That's good job. Well done. Yes, the 4th of July, one of my favorite holidays.
Is it?
Yeah, absolutely. Getting out there in the sunshine, enjoying some hot dogs, some hamburgers.
Some fireworks at night.
Oh, beautiful. Beautiful. Makes me happy to be here. Absolutely. All right. So let's talk about the next stages of the process. So hopefully everybody in the chat, you've already sent out your application. If you've not done so, do it right now. But for those who've got their application, the next step would be that interview stage.
Yes.
So what does that look like?
Yeah. So before we go into some tips, I just wanted to kind of show you the interview process as it stands here at Avant. So there's really 3 major steps of our hiring process. So number 1, surveys. So we will send you a survey to fill out before you even go to your first interview. Now, these questions, some of them are like about, why you want to move to the US, answering some basic questions that you may have already had in your resume, or just kind of giving us a bit more insight. And there's also clinical questions as well. Now, the reason we give you this survey before your interview, because you might be asking, well, why don't you just ask me this on the call? We want to make the most of the time that we have with you on the phone. So if you can answer some of these simple questions before you get on the call with your recruiter, then it leaves more time for the call to go over the really important things and to dig deeper into some of these questions, and to leave time at the end so that you can ask whatever questions that you have to your recruiter. Now, one thing I want to make sure that is pointed out is when you get to the clinical questions of the survey, the very first question is going to ask you, what unit are you currently working in?
That's
so
right.
Super, super important that you answer for the unit that you're in right now, or at the time that you take the survey, because we don't want to know about your past unit or the unit that you want to be in. What's most important is to know what you're doing at the moment of your interview. So be sure to answer that question correctly, because it's going to generate some additional questions and also help your clinical recruiter for that interview. But let's say you finish the surveys, you get the interviews on the schedule. There are going to be 2 interviews in this process. So there's a program interview and a clinical interview. Now, we'll talk more about those in detail, but one thing I just want to kind of point out as a really good tip is make sure that you are available on time in a quiet place and that you have strong call connection. So whether your call is going to be over the phone, maybe you're doing a WhatsApp call, maybe it's a video call, whatever method your call is going to be, make sure you are prepared for that in a good place with strong connection so that there's no interruptions during the interview itself.
That's right. And double check that time. When you are making your application, when you have found out the time of your interview, make sure that you are double checking that it's the time where you are, because obviously we're going to have a time difference. Right now, it's still the morning here in the US. And I know it's might be deep into the night for you guys. So double check that interview time as well.
And then as expected, just with any kind of back and forth situation like a hiring process is, there's very often going to be some sort of follow-up. So your recruiter may reach out to you after the interview via email, via text message, phone call. So just keep an eye on your communications. This type of follow-up could be that they need to actually request some documentation from you. Let's say you told them on the call you've passed an English exam. We're going to want to see a copy of that English exam. So you're going to need to send those kind of things, or we might need to ask for some other documentation during this recruitment process just to verify, employment or whatever the case may be. So whatever is requested of you, the quicker you can send that information in, the quicker the review of your application can be completed, and hopefully you get offered that contract.
That's right. Here in the USA, email is king. It is absolutely our number one way to get in contact with you guys. And I know for a lot of people, checking your email regularly, it's not something that you do very often. But if you're in the Avant process, checking that email multiple times a day is probably your best bet. So get used to checking that email, and check that spam folder too, just in case. Absolutely. So we've got 2 different interviews. So let's talk about that process interview. What tips could you give us to make sure that we really nailed that process interview?
So for most of you, this will be the first interview that you'll do. So number 1, I would say make sure that your CV or your resume is up to date and accurate. So yes, you might have already submitted that. Take a look at it, read through it before you get on this call, just to make sure that you don't notice any mistakes or anything like that. And if you do, it's okay. You don't have to stress about it. Just let your recruiter know. But that way you just kind of understand what the recruiter is looking at and referencing as they're speaking to you on this phone call. Second thing on here is we say, be ready to discuss your why. Really, what is your motivation? Like, why do you want to take on this journey and move to the US? It's not an easy process. So thinking about the reason behind you deciding to take on this journey, that's something that we're going to want to discuss with you. There's no right or wrong answers here. We just want to understand kind of what your motivation is. think through the logistics as well. You know, moving to the US, as we've mentioned, it can be a challenging process. There's a lot of moving parts. If you plan to bring a spouse or children with you, think through what that might look like and what your individual situation is like. You need to think through your finances. While we do cover a lot of the cost of the process, we don't cover everything. So you do need to have some savings before you arrive in the US. And this is something that your recruiter will start a discussion with you, and this will carry on through many different steps of the process as well. During the call, make sure that you're, as I mentioned, in a place that has good connection, but speak with volume and clarity. We want you to display confidence and enthusiasm and professionalism. And if that's something that doesn't come natural to you, that's okay. But just, you know, we want you to show who you truly are. You don't have to feel like you can't let your personality shine. We want to know who you are and who we're speaking with. Our recruiters, as you'll find out very quickly, are very kind and excited to talk to you. So don't be afraid to loosen up a little bit. Of course, be professional, but show them who you are. And last tip here for this program interview is to prepare questions. If there was anything that we talked about today that you are unsure of or would like to learn a little bit more of, tip number one really is go and check out our YouTube, check out our Instagram, learn, because we have a lot of different content out there to teach you about the process. But if there's anything that you want to discuss further with your recruiter, bring those questions with you on the call, because this is your one-on-one time to ask the questions that are important to you as an individual.
That's absolutely right. And that support is going to be on every single channel. As you said, we said on YouTube, on Facebook, on Instagram. You can email us at recruitment@avanthealthcare.com. We want to hear from you. And that especially counts in your interview as well. So if you've got those questions, it doesn't help you to keep it inside, just ask us and we'll be happy to answer for you.
Yeah, definitely.
So that's the program interview. Next to be the clinical interview.
Yeah.
How can you help us there?
So this one is probably where I hear nurses express that they have the most nerves for, which I think is funny, not funny, but an interview, yes, you can be nervous for it, but just know that for a clinical interview, this is your chance to just talk about what you do every day as a nurse. So be prepared to share the details about what you do at work. We're going to ask you some questions about the facility itself, like how many beds are there? What kind of units are there? What does your unit look like? And what does your role in that unit look like? So we're going to ask about, the common cases that you're handling, what types of skills you perform as a nurse, and maybe even ask you some scenario-based questions, like if a patient came in and presented with this, what would you do? So again, we're just trying to understand what it's like in this setting that you're working in, where your skills are at, so that we can eventually figure out what kind of a placement we can find for you here in the United States. So again, really good to be open and honest during this interview. Make sure that you are sharing as much information as you can, be as specific as you can. If you're asked a question like, how often do you perform XYZ skill? Be specific, instead of saying, oh, I do that all the time. What does that mean? Tell us, oh, I do that 6 times a day, something that's a bit more tangible. That's really going to help your clinical nurse recruiter understand what you do on a day-to-day basis.
That's right. And that crucial point at the end there, being open and honest. That is number one priority for us, is to make sure that we're getting the right information from you. And, if we get false information, if we can tell that you're holding information back, then we will find that out. And if at worst, it's just going to delay your process and it may even disqualify you. So make sure that when you're making an application, it is 100% authentic to you. And the right information.
Yeah, don't embellish for the sake of embellishing, right? Share as much as you can that's honest and truthful. Obviously, you want to put your best foot forward. We get that. It's an interview process. You want to get hired. Totally understandable. But the best thing you can do is to be, as we said, honest, explain exactly the situation as it is. And our team will ask for more information if we feel like any is warranted.
All right, brilliant. So now I feel like you guys should be ready for your interview, but you're not going to get an interview unless you apply. Make it happen. Do it right now. This is an opportunity that you do not want to miss. Get it in there. We'll be here all day. Our recruiters are still on the phone. They are waiting for you. They're going to be busy. They're going to be going all through the day, and they're just waiting for your call. We can't wait to get that call from you. All right. So with that said, we're about wrapping up the live portion of today's events. As I mentioned, we're going to be here all day. Just because this live stream is ending does not mean that we're not waiting for your call. So get it in there, get that application happening. And yeah, we can't wait to see you. So what do you say we go over there and say hello to the recruiters?
Yeah, let's head down the hallway, shall we?
Let's go and say hi. All right. Thank you so much, everybody. We'll see you next time. Have a great day.